Remember the before times? Life before masks, social distancing, and the constant fear of a cough? Yeah, me too. It feels like a lifetime ago. It was early 2020 when the world as we knew it changed. A novel coronavirus, SARS-CoV-2, emerged, spreading rapidly across the globe. It seemed like something out of a science fiction movie. Except it was all too real. The virus, which causes the disease COVID-19, brought with it a wave of uncertainty and fear. We were bombarded with news reports, scientific findings, and government guidelines, all trying to make sense of this invisible threat. Lockdowns were enforced, businesses shuttered, and schools moved online. Life as we knew it ground to a halt. The world held its breath, waiting for answers. Scientists raced to understand the virus, develop tests, and find a vaccine. Healthcare workers became frontline heroes, battling tirelessly to save lives. We were all in this together, united in our fear and our hope for a brighter future. The early days of the pandemic were a blur of anxiety and uncertainty. We were glued to our screens, desperately seeking information and reassurance. Social media became a double-edged sword, spreading both vital updates and harmful misinformation. The virus didn't discriminate, affecting people of all ages, backgrounds, and walks of life. We mourned the loss of loved ones, often unable to say goodbye in person. The pandemic exposed deep inequalities in our society, disproportionately impacting marginalized communities. The mental health toll of isolation, fear, and grief was immeasurable. Yet, amidst the darkness, there were also glimmers of hope. Stories of resilience, compassion, and human connection emerged. Neighbors helping neighbors, strangers supporting essential workers, and communities coming together, virtually, to uplift one another. As months turned into years, we began to adapt to this new normal. We learned to navigate a world of masks and social distancing. We found creative ways to connect with loved ones, from virtual game nights to drive-by birthday celebrations. And finally, after what felt like an eternity, vaccines arrived. The development of safe and effective vaccines was a testament to the ingenuity and collaboration of the global scientific community. Vaccination campaigns rolled out, offering a beacon of hope for a return to normalcy. Life began to resemble its pre-pandemic rhythm, albeit with a newfound appreciation for the simple things. But the virus, as viruses tend to do, continued to evolve. New variants emerged, some more transmissible, some more resistant to vaccines. The pandemic was far from over, and a sense of caution lingered in the air. Fast forward to 2024. The world looks vastly different from the early days of the pandemic. Masks, while still a common sight, are no longer mandatory in many places. Life has largely resumed its pre-pandemic rhythm, with businesses open, schools bustling, and people traveling once again. But the question remains, is COVID-19 still a threat in the USA in 2024? The answer, as with many things related to this pandemic, is complex. While we've made significant progress, the virus is still circulating. New variants continue to emerge, and breakthrough infections, though typically mild, are still possible. So while we've come a long way, we can't let our guard down entirely. We need to stay informed, make responsible choices, and continue to prioritize the health and well-being of ourselves and our communities. Section 5. Our COVID-19 journey continues. The COVID-19 pandemic has been a defining event of our time. It has tested our resilience, challenged our assumptions, and forced us to confront uncomfortable truths about ourselves and our world. But it has also revealed the extraordinary capacity of the human spirit for innovation, compassion, and collective action. In the next part of this video, we'll delve deeper into the current state of COVID-19 in the USA in 2024. We'll examine the latest statistics and trends, explore the impact of government policies and public health measures, and hear personal stories from those directly affected by the virus. So buckle up and join us as we navigate the evolving landscape of COVID-19 and explore what it means to live in a world forever changed by this pandemic. Section 1. The Numbers Game. All right, let's dive into the nitty-gritty. When trying to understand where we stand with COVID-19 in 2024, it all starts with the numbers. We're talking infection rates, hospitalization numbers, and sadly, the number of lives lost. These figures, often displayed on graphs and charts, paint a picture of the pandemic's trajectory. Now remember those early days of the pandemic when we were glued to our screens, watching the case counts climb with bated breath? Thankfully, things are different now. The numbers have stabilized significantly since the initial waves of infection, but that doesn't mean we're entirely in the clear. While we're not seeing the dramatic spikes of the past, the virus is still circulating. New cases are reported daily, and there are still hospitalizations and unfortunately deaths, but the overall picture is much less dire than it was a few years ago. Section 2. Deciphering the data. So, how do we make sense of all these numbers? Well, it's not just about looking at the raw data. We need to consider things like testing rates, which can influence the number of reported cases. We also need to factor in the emergence of new variants, which can impact transmission and severity of illness. Another crucial aspect is understanding the difference between cases, hospitalizations, and deaths. A high case count doesn't necessarily translate to a surge in hospitalizations or deaths, especially with widespread vaccination and effective treatments available. It's also important to remember that data can vary significantly from region to region. What's happening in one state might be very different from what's happening in another. So, while national data provides a broad overview, it's crucial to pay attention to local trends as well. Speaking of regional differences, the fight against COVID-19 in the USA has been anything but uniform. We've seen a patchwork of progress, with some areas faring better than others. Factors like vaccination rates, public health measures, and even weather patterns have contributed to these disparities. In some states, particularly those with high vaccination rates and strong public health infrastructure, life has largely returned to a semblance of normalcy. But in other areas, where vaccine hesitancy persists and resources are stretched thin, the virus continues to pose a greater threat. This regional variation highlights the importance of tailored public health interventions. What works in one community might not be effective or necessary in another. A one-size-fits-all approach simply doesn't cut it when dealing with a complex and evolving virus like COVID-19. Remember when we thought we were finally getting a handle on this thing, and then a new variant popped up? Yeah, the emergence of new variants has been one of the most challenging aspects of this pandemic. Each variant brings with it a new set of characteristics, some more concerning than others. We've seen variants like Delta and Omicron burst onto the scene, spreading rapidly and causing surges in cases. These variants often come with increased transmissibility, meaning they can spread more easily from person to person. Some variants have also exhibited increased immune escape, meaning they're better at evading the protection offered by vaccines or prior infection. This constant evolution of the virus has kept scientists on their toes and made it challenging to predict the trajectory of the pandemic. Now, let's talk about the good news. Vaccines have been a game changer in our fight against COVID-19. These remarkable scientific achievements have dramatically reduced the risk of severe illness, hospitalization, and death from the virus. The development and rollout of safe and effective vaccines have been nothing short of extraordinary. Vaccination rates have steadily climbed since those early days of limited supply and long lines at vaccination sites. But while we've made significant progress, we're not quite at the finish line yet. Vaccination rates still vary across the country, and there are pockets of hesitancy that need to be addressed. Section 6. Herd immunity, elusive or achievable. You've probably heard the term herd immunity thrown around a lot. It refers to the idea that when a sufficiently high percentage of the population is immune to a virus, either through vaccination or prior infection, it becomes difficult for the virus to spread. Achieving herd immunity with COVID-19 has proven to be a moving target. The emergence of new variants, some with increased immune escape, has made it more challenging to reach the threshold needed for widespread protection. However, even if we don't completely eradicate the virus, widespread vaccination can significantly reduce its impact. It can help prevent severe illness, ease the strain on healthcare systems, and allow us to return to a more normal way of life. Section 7. Long COVID, a shadow pandemic. While we've made significant strides in treating acute COVID-19 infections, a new concern has emerged: long COVID. This condition, also known as post-COVID syndrome, affects a significant number of people who have recovered from the initial infection. Long COVID can manifest as a wide range of debilitating symptoms, including fatigue, brain fog, shortness of breath, and joint pain. These symptoms can persist for months or even years after the initial infection, significantly impacting people's quality of life. The exact causes of long COVID are still being investigated, but it's believed to be a complex interplay of factors, including persistent inflammation, autoimmune responses, and damage to various organs. Section 1. Navigating a sea of policies. Remember those early days of the pandemic when every day seemed to bring a new set of guidelines, restrictions, and recommendations? Yeah, navigating the ever-changing landscape of COVID-19 policies has been a wild ride, to say the least. From mask mandates to travel bans, the government has implemented a wide range of measures to try and curb the spread of the virus. These policies, often implemented at the state or local level, have varied significantly across the country. We've seen everything from strict lockdowns to a more relaxed approach, with each jurisdiction trying to strike a balance between protecting public health and minimizing economic and social disruption. This patchwork of policies has at times led to confusion and frustration among the public. What's allowed in one state might be prohibited in another, making it challenging to keep up with the latest guidelines, especially for those who travel frequently. Section 2. Mask mandates on again, off again. Masks. Those ubiquitous pieces of cloth have become both a symbol of the pandemic and a subject of much debate. Mask mandates, requiring people to wear face coverings in public settings, have been one of the most visible and controversial COVID-19 policies. Proponents of mask mandates argue that they're a simple and effective way to reduce the spread of the virus, especially in indoor settings where transmission is more likely. They point to studies showing that masks can act as a barrier, preventing respiratory droplets from spreading through the air. Opponents, however, argue that mask mandates infringe on personal liberty and that the evidence supporting their effectiveness is inconclusive. They also raise concerns about the potential negative impacts of masks, such as hindering communication and creating a sense of fear and distrust. Section 3. Social distancing, finding our space. Remember the days of carefully measuring 6 feet apart from others in grocery store lines? Social distancing, the practice of maintaining physical distance from others, has been another cornerstone of our pandemic response. From floor markers in stores to capacity limits in restaurants, we've all had to adjust to a world where personal space is paramount. The rationale behind social distancing is simple. The farther apart we are, the less likely we are to spread or contract the virus. By reducing close contact between individuals, we can disrupt the chain of transmission and slow the spread of COVID-19. While social distancing measures have undoubtedly helped to curb the spread of the virus, they've also had significant social and economic consequences. Businesses have struggled with reduced capacity, social gatherings have been limited, and many people have experienced loneliness and isolation as a result of prolonged physical distancing. Section 4. Testing. From scarcity to surplus? In the early days of the pandemic, getting tested for COVID-19 was a major challenge. Testing sites were overwhelmed, results took days or even weeks to come back, and access to testing was often limited to those with symptoms or known exposure. Fast forward to 2024, and the testing landscape looks vastly different. The development and distribution of rapid antigen tests, which can provide results in minutes, have been a game changer. These at-home tests have made it easier than ever for people to know their status, allowing them to make informed decisions about their health and the health of others. Despite the increased availability of testing, there are still challenges. The accuracy of rapid antigen tests can vary, and they're most reliable when used by people with symptoms. Additionally, access to testing can still be inequitable, with marginalized communities often facing greater barriers to testing resources. Section 5. The vaccine debate mandates, passports, and personal choice. Perhaps no other aspect of the pandemic response has been as polarizing as the debate surrounding COVID-19 vaccines. From vaccine mandates to vaccine passports, the issue of vaccination has sparked heated discussions about individual liberty, public health, and the role of government. Vaccine mandates requiring vaccination for certain activities or employment have been implemented in some settings, such as healthcare facilities and schools. Proponents argue that mandates are necessary to protect vulnerable populations and ensure the functioning of essential services. Opponents, however, view mandates as an overreach of government authority and an infringement on personal freedom. They argue that individuals should have the right to make their own healthcare decisions, even if those decisions go against public health recommendations. Section 6. Boosters, staying ahead of the variant curve. As the virus has evolved, so too has our vaccination strategy. The emergence of new variants, some with increased immune escape, has led to the recommendation for booster doses of the COVID-19 vaccine. These additional doses are designed to bolster our immune response and provide continued protection against severe illness. The need for boosters has been a point of contention for some. While many have embraced the opportunity for additional protection, others have questioned the necessity of boosters, particularly given the relatively low rate of severe illness among vaccinated individuals. The decision of whether or not to get a booster is a personal one, and it's essential to weigh the potential benefits and risks based on individual circumstances. Factors to consider include age, health status, risk of exposure, and the prevalence of COVID-19 in the community. Section 7. Treatment advancements, a glimmer of hope. While vaccines have been a crucial tool in combating the pandemic, significant progress has also been made in developing effective treatments for COVID-19. Antiviral drugs, monoclonal antibodies, and other therapies have shown promise in reducing the severity of illness and preventing hospitalization. These treatment advancements have been particularly impactful for high-risk individuals, such as the elderly and those with underlying health conditions. By reducing the risk of severe illness in these populations, treatments have helped to alleviate the strain on healthcare systems and save lives. However, access to these treatments can be limited, and they're often most effective when administered early in the course of the illness. Additionally, the emergence of new variants has raised concerns about the potential for reduced effectiveness of some treatments. The economic tightrope balancing public health and livelihoods. The COVID-19 pandemic has not only been a public health crisis, but also an economic one. Lockdowns, business closures, and reduced consumer spending have had a profound impact on the global economy, leading to job losses, business failures, and widespread financial hardship. Governments around the world have faced the daunting task of trying to mitigate the economic fallout while also protecting public health. Stimulus packages, unemployment benefits, and other measures have been implemented to provide a safety net for those affected by the pandemic. However, the economic recovery has been uneven, and many businesses and individuals continue to struggle. The pandemic has exposed and exacerbated existing inequalities, disproportionately impacting low-wage workers, minority-owned businesses, and other vulnerable populations. Schools in, or is it? The challenges of educating in a pandemic. Remember the great online learning experiment of 2020? Yeah, the COVID-19 pandemic has upended the education system, forcing schools and universities to adapt to a new reality of remote learning, hybrid models, and constantly evolving safety protocols. The shift to remote learning has presented numerous challenges, from ensuring equitable access to technology and internet to addressing the social and emotional needs of students who thrive in traditional classroom settings. The quality of education has also been a concern, with some students falling behind academically due to the disruptions caused by the pandemic. As we've transitioned back to in-person learning, schools have faced the ongoing challenge of maintaining a safe and healthy environment for students and staff. Mask mandates, social distancing measures, and regular testing have become the norm in many schools, but these measures have not been without controversy. The travel bug, navigating a world of restrictions and requirements. Remember the days of spontaneous getaways and carefree globetrotting? Yeah, the COVID-19 pandemic has grounded those dreams for now. International travel has become a logistical puzzle, with ever-changing restrictions, testing requirements, and quarantine rules. Countries around the world have implemented a patchwork of travel restrictions, from outright bans on certain nationalities to mandatory quarantine periods upon arrival. These restrictions, while intended to curb the spread of the virus, have created uncertainty and confusion for travelers. In addition to travel restrictions, many countries now require proof of a negative COVID-19 test before entry, regardless of vaccination status. These testing requirements, while understandable from a public health perspective, have added an extra layer of complexity and cost to international travel. Section 11. The media's role informing, misinforming, or somewhere in between. In the age of social media and 24/7 news cycles, the media has played a pivotal role in shaping public perception of the COVID-19 pandemic. From disseminating vital information about the virus and public health guidelines to providing a platform for expert analysis and debate, the media has been both a source of clarity and confusion. While many media outlets have strived to provide accurate and reliable information, the rapid pace of the pandemic, coupled with the ever-evolving scientific understanding of the virus, has made it challenging to keep up. Misinformation, disinformation, and sensationalized reporting have also proliferated, particularly on social media platforms, fueling fear and distrust. The media's coverage of the pandemic has also reflected the polarization and politicization that have come to characterize our society. Different media outlets have presented vastly different narratives about the severity of the virus, the effectiveness of public health measures, and the appropriateness of government responses. Section 12. Public trust, a fragile foundation. The COVID-19 pandemic has tested our trust in institutions, experts, and each other. From the initial response to the virus, to the rollout of vaccines and the implementation of public health measures, public trust has been both a crucial asset and a casualty of the pandemic. The erosion of public trust has had far-reaching consequences, undermining the effectiveness of public health interventions, fueling vaccine hesitancy, and exacerbating social divisions. The spread of misinformation and disinformation, often amplified by social media algorithms, has further eroded trust in traditional sources of information. Rebuilding public trust is essential for navigating the ongoing challenges of the pandemic and preparing for future health crises. This requires transparency from institutions, clear and consistent communication from experts, and a commitment to combating misinformation and promoting media literacy. Section 13. The road ahead, balancing vigilance with a return to normalcy. As we enter the fourth year of the COVID-19 pandemic, the question on everyone's mind is, what's next? The world has been through an unprecedented period of upheaval, and the journey has been fraught with challenges. From lockdowns and social distancing to the rapid development and distribution of vaccines, the global response has been nothing short of extraordinary. Yet, the virus continues to be a part of our lives, and the path forward remains uncertain. The virus has thrown us curveball after curveball, and predicting the future with any certainty feels like a fool's errand. Each new variant brings with it a fresh wave of concern, and the scientific community is constantly working to stay ahead of the virus. The unpredictability of the situation has made it clear that we must remain adaptable and resilient in the face of ongoing challenges. However, by examining the current landscape, we can start to envision a path forward, a delicate balance between vigilance and a return to normalcy. This balance is not about choosing one over the other, but finding a way to integrate both into our daily lives. It means continuing to take precautions while also finding ways to reconnect with the activities and people we love. While the virus is still circulating and new variants continue to emerge, we're in a much better place than we were a year ago, let alone 2 or 3 years ago. The development and distribution of vaccines have been a game changer, providing a level of protection that was previously unimaginable. Vaccination efforts have been ramped up globally, and booster shots are being administered to enhance immunity. Vaccines have dramatically reduced the risk of severe illness, treatments have improved, and we've learned to adapt to a new normal. The healthcare system has become more adept at managing COVID-19 cases, and new treatments are continually being developed. This progress has given us the tools to better protect ourselves and our communities. The path forward will require a nuanced approach, one that acknowledges the ongoing threat of the virus, while also recognizing the need to resume aspects of our pre-pandemic lives. This means finding ways to safely gather with loved ones, travel, and engage in social activities. It also means being mindful of the risks and taking steps to mitigate them, such as wearing masks in crowded places and practicing good hygiene. We'll need to remain vigilant, monitoring for new variants, promoting vaccination and booster uptake, and being prepared to adapt our strategies as needed. Public health officials will continue to play a crucial role in guiding us through this transition, using data and science to inform their recommendations. Community awareness campaigns will be essential in keeping the public informed and engaged in the ongoing efforts to combat the virus. The pandemic has also brought about significant changes in the way we work and live. Remote work has become more common, and many organizations have adopted flexible work arrangements. This shift has allowed people to find a better work-life balance and has opened up new opportunities for those who may have previously been limited by geographical constraints. Education has also undergone a transformation, with virtual learning becoming a staple for many students. While this has presented its own set of challenges, it has also highlighted the potential for technology to enhance the learning experience. Educators and students alike have had to adapt to new methods of teaching and learning, and this adaptability will serve them well in the future. The pandemic has also encouraged many people to explore new hobbies and interests. With restrictions on indoor activities, outdoor pursuits have gained popularity. People have taken up hiking, cycling, and other forms of exercise, finding solace and enjoyment in nature. This shift towards a more active lifestyle has had positive effects on both physical and mental health. One of the silver linings of the pandemic has been the sense of community and solidarity that has emerged. People have come together to support one another, whether through mutual aid groups, volunteering, or simply checking in on neighbors. This sense of togetherness has been a source of strength and resilience, reminding us of the importance of human connection. Looking ahead, ongoing research and innovation will be key to navigating the road ahead. Scientists are continually studying the virus and its variants, developing new treatments and vaccines, and exploring ways to prevent future pandemics. This commitment to scientific advancement will be crucial in ensuring that we are better prepared for whatever challenges may come our way. As we move forward, it's important to remain cautiously optimistic. While the road ahead may be uncertain, we have made significant progress and have reason to hope for a brighter future. By balancing vigilance with a return to normalcy, we can navigate this new chapter with resilience and determination. Together, we can build a future that is not only safer, but also more connected and compassionate. Beyond the statistics putting a human face on the pandemic, we've talked a lot about numbers, haven't we? Infection rates, vaccination percentages, hospitalization figures. But behind those numbers are real people with real stories. Stories of resilience, of loss, of fear, and of hope. It's time to put a human face on this pandemic, to listen to the voices of those directly impacted by COVID-19. These are the stories that remind us that COVID-19 isn't just an abstract threat. It's a reality that has touched the lives of millions of Americans. Each story is a testament to the human capacity for strength, compassion, and perseverance in the face of adversity. By sharing these stories, we hope to foster empathy and understanding. We want to show the human toll of the pandemic, not to dwell on the negative, but to remind ourselves that we're all in this together. The long road to recovery. One survivor's story. Meet Sarah, a 32-year-old marathon runner from Chicago. Sarah's life was a testament to health and fitness. She had always been an active individual, participating in marathons and various athletic events. Her dedication to running was not just a hobby, but a way of life. She thrived on the energy of the races, the camaraderie of fellow runners, and the sheer joy of pushing her limits. Before COVID-19, Sarah was the picture of health and vitality. Her daily routine included early morning runs, balanced meals, and a disciplined lifestyle. Friends and family admired her commitment and often sought her advice on fitness and wellness. She was an inspiration to many, embodying the spirit of perseverance and strength. But her life took an unexpected turn when she contracted the virus in the spring of 2023. It started with a slight cough and a feeling of fatigue, symptoms she initially dismissed as a minor cold. However, within days, her condition worsened. The virus attacked her respiratory system with a ferocity that left her gasping for air. The once vibrant and energetic Sarah found herself bedridden, struggling to breathe. What started as a mild cough and fatigue quickly escalated into a life-threatening illness. Sarah's symptoms intensified, and she was soon admitted to the hospital. The medical team worked tirelessly to stabilize her condition, but the virus was relentless. Each day was a battle, with Sarah fighting to stay alive. The isolation of the hospital room, the constant beeping of machines, and the uncertainty of her prognosis weighed heavily on her. Sarah spent weeks in the hospital, hooked up to oxygen and battling for every breath. The virus had ravaged her lungs, leaving her weak and struggling to perform even the simplest tasks. Breathing, something she had always taken for granted, became a monumental effort. The physical toll was immense, but the emotional and psychological impact was equally challenging. She missed her family, her friends, and the freedom of her previous life. The virus had ravaged her lungs, leaving her weak and struggling to perform even the simplest tasks. The doctors warned her that recovery would be long and arduous, but Sarah was determined to regain her health. She knew that the road ahead would be tough, but she was not one to back down from a challenge. With the support of her medical team and loved ones, she began the slow journey towards recovery. The doctors warned her that recovery would be long and arduous, but Sarah was determined to regain her health. She started with small steps, literally and figuratively. Simple exercises, breathing techniques, and a carefully monitored diet became her new routine. Each day brought small victories, and Sarah celebrated each one. Her determination was unwavering, and she drew strength from the progress she made, no matter how incremental. Months after her initial infection, Sarah still experiences lingering effects of the virus, a condition known as long COVID. The fatigue is overwhelming at times, making it difficult to get through the day. Brain fog clouds her thoughts, and shortness of breath limits her physical activities. These symptoms are a constant reminder of the battle she fought and the journey she continues to navigate. She struggles with fatigue, brain fog, and shortness of breath, making it difficult to return to her active lifestyle. The marathon runner who once conquered miles with ease now finds herself exhausted after a short walk. The mental and emotional toll of these limitations is significant, but Sarah remains resolute. She refuses to let long COVID define her or dictate her future. But Sarah refuses to let long COVID define her. She has always been a fighter, and this challenge is no different. She draws on the same strength and determination that fueled her marathon runs. Her spirit remains unbroken, and she is committed to reclaiming her life. Each day is a step forward, and she embraces the journey with courage and resilience. She's slowly regaining her strength through pulmonary rehabilitation, support groups, and sheer determination. The road to recovery is long, but Sarah is not alone. She has found a community of fellow survivors who understand her struggles and share her hopes. Together, they support each other, celebrate progress, and find strength in their shared experiences. Sarah's story is one of hope, resilience, and the unyielding human spirit. When COVID-19 hits home, a family's experience. For the Johnson family from Atlanta, COVID-19 wasn't just a news story, it was a stark reality that ripped through their lives. The pandemic, which had already claimed millions of lives worldwide, suddenly became a personal battle for them. The virus, which they had only seen on TV and read about in newspapers, was now at their doorstep, threatening the very fabric of their family. When 65-year-old patriarch Robert contracted the virus in the fall of 2024, the family was cautiously optimistic. Robert had always been a pillar of strength, a man who had faced numerous challenges in life and emerged victorious. He was a retired firefighter, a community hero who had saved countless lives during his career. His family believed that if anyone could beat the virus, it would be him. He was fully vaccinated and boosted, and his symptoms were initially mild. The family took comfort in the fact that he had taken all the necessary precautions. They had read about the effectiveness of the vaccines and were hopeful that Robert's strong immune system, bolstered by the vaccine, would help him recover quickly. But as days turned into weeks, Robert's condition worsened. What started as a mild cough and fever soon escalated into severe respiratory distress. The family watched helplessly as Robert's health deteriorated. They were in constant touch with the doctors, hoping for some good news, but the updates were always grim. He was hospitalized and placed on a ventilator as the virus attacked his lungs. The sight of Robert, a man who had always been so full of life, now lying helplessly in a hospital bed, was heart-wrenching. The beeping of the medical equipment, the sterile smell of the hospital, and the sight of the ventilator became a constant reminder of the severity of the situation. The family anxiously awaited updates from the hospital, their hope dwindling with each passing day. They spent countless hours in the hospital waiting room, clinging to each other for support. The once vibrant and lively family gatherings were now replaced with moments of silence and tears. They prayed for a miracle, but deep down, they knew that the situation was dire. Despite the best efforts of medical staff, Robert lost his battle with COVID-19, leaving behind a heartbroken family grappling with their loss. The news of his passing was a devastating blow. The family, who had always been so close-knit, now found themselves struggling to cope with the immense grief. The loss of Robert left a void that could never be filled. Robert's wife, Mary, and their 2 adult children, Michael and Lisa, are now navigating the complex emotions of grief while trying to piece their lives back together. They often gather to look at old photographs, reminiscing about the good times they shared with Robert. Each photograph tells a story, a memory of happier times when the family was whole. They find solace in their memories of Robert, a loving husband, father, and grandfather who brought joy to everyone he met. His laughter, his wisdom, and his unwavering support are deeply missed. The family holds candlelight vigils in his memory, a small way to honor the man who meant so much to them. These gatherings, though somber, provide a sense of comfort and unity. Their story is a poignant reminder that even amidst progress, the virus can still claim lives, leaving behind a void that can never be filled. The empty chair at the family table is a stark reminder of Robert's absence. The family continues to reflect on the memories they shared with him, finding strength in each other as they navigate this new reality. Their experience serves as a powerful testament to the impact of COVID-19, a reminder that the fight against the virus is far from over. The emotional toll, coping with loss, grief, and uncertainty. The COVID-19 pandemic has left an undeniable emotional scar on the American psyche. We've all experienced loss in some form, whether it's the loss of a loved one, the loss of normalcy, or the loss of a sense of security. This collective trauma has manifested in various ways, from increased rates of anxiety and depression to a heightened sense of fear and uncertainty about the future. The constant barrage of news, the ever-changing guidelines, and the fear of contracting the virus or seeing it spread to loved ones have taken a toll on our mental well-being. Many people have reported feeling overwhelmed, stressed, and emotionally drained. The pandemic has also exacerbated existing inequalities, disproportionately impacting marginalized communities who were already facing systemic barriers to mental health care. The loss of loved ones, economic hardship, and social isolation have amplified these disparities, highlighting the urgent need for accessible and culturally competent mental health services. Frontline fatigue healthcare workers reflect on the pandemic. Few professions have been as profoundly impacted by the COVID-19 pandemic as healthcare. Doctors, nurses, respiratory therapists, and countless other healthcare workers have been on the front lines of this crisis, working tirelessly to care for the sick, comfort the dying, and hold the hands of those who couldn't be with their loved ones. These everyday heroes have witnessed unimaginable suffering and loss, often putting their own health at risk to care for others. They've worked grueling hours, faced shortages of personal protective equipment, and grappled with the emotional toll of witnessing the devastating impact of the virus firsthand. The pandemic has exposed the resilience and compassion of healthcare workers, but it has also highlighted the urgent need to address systemic issues within the healthcare system, such as staffing shortages, inadequate mental health support, and burnout. Essential workers, the unsung heroes of the pandemic. While healthcare workers have rightfully received much-deserved recognition for their sacrifices during the pandemic, let's not forget the countless other essential workers who have kept our society functioning. From grocery store clerks and delivery drivers to sanitation workers and public transportation operators, these everyday heroes have kept our shelves stocked, our streets clean, and our communities connected. These essential workers, often working in low-wage jobs with limited benefits, have faced increased risks of exposure to the virus while ensuring that our essential needs are met. They've shown up to work day after day, often without complaint, putting the needs of their communities before their own. The pandemic has shone a light on the vital role that essential workers play in our society and the need to ensure their safety, well-being, and economic security. It's a reminder that every job is essential when it comes to keeping our communities running smoothly. The COVID-19 pandemic has had a ripple effect, impacting virtually every aspect of our lives and communities. From the way we work and learn to the way we socialize and access essential services, the pandemic has forced us to reevaluate our priorities, adapt to new norms, and find creative solutions to unprecedented challenges. The pandemic has exposed and exacerbated existing inequalities, disproportionately impacting marginalized communities who were already facing systemic barriers to healthcare, education, and economic opportunity. The virus has laid bare the fault lines in our society, highlighting the urgent need for equitable access to resources and opportunities. Despite the challenges, the pandemic has also revealed the resilience of our communities and the power of collective action. We've seen neighbors helping neighbors, strangers supporting essential workers, and communities coming together, both virtually and in person, to uplift one another. Amidst the challenges and heartbreak, the COVID-19 pandemic has also sparked countless stories of resilience, hope, and adaptability. We've seen individuals, businesses, and communities find creative ways to navigate the uncertainty, support each other, and emerge from the crisis stronger than before. Take, for example, the story of Maria, a single mother who lost her job as a restaurant server during the early days of the pandemic. Faced with mounting bills and a dwindling savings account, Maria refused to give up. She tapped into her passion for baking and started a small business selling homemade pastries online. Word of mouth spread quickly, and soon Maria's business was thriving, providing her with a new sense of purpose and financial security. Maria's story is just one example of the countless ways people have adapted and thrived amidst the challenges of the pandemic. These stories remind us that even in the darkest of times, the human spirit has an incredible capacity for innovation, creativity, and resilience. The COVID-19 pandemic has forced us to rethink the way we connect with others. Social distancing measures, lockdowns, and the fear of spreading the virus have made it challenging to maintain social connections, which are essential for our mental and emotional well-being. Despite these obstacles, we've witnessed the enduring power of human connection. We've found creative ways to bridge the physical distance, from virtual happy hours and online game nights to drive-by birthday parades and socially distanced picnics in the park. The pandemic has reminded us that human connection is not limited to physical proximity. It's about reaching out, offering support, and nurturing our relationships, even when we can't be in the same room. The COVID-19 pandemic has taken a toll on our collective mental health. The constant uncertainty, fear, and disruption to our daily lives have left many feeling anxious, stressed, and emotionally drained. It's more important than ever to prioritize our mental well-being and seek support when we need it. There's no shame in asking for help. Talking to a therapist, counselor, or trusted friend or family member can provide a valuable outlet for processing our emotions and developing coping mechanisms. There are also numerous online resources, hotlines, and support groups available for those who need someone to talk to. Remember that taking care of our mental health is not a luxury, it's a necessity. It's about prioritizing our well-being, setting boundaries, engaging in self-care practices, and seeking professional support when needed. The COVID-19 pandemic has been a collective trauma, but it has also been a catalyst for reflection and growth. As we emerge from this crisis, we do so with a newfound appreciation for the fragility of life, the importance of human connection, and the interconnectedness of our world. The pandemic has forced us to slow down, reevaluate our priorities, and appreciate the simple things in life. It has reminded us that our health is precious, that time with loved ones is a gift, and that we're all part of something larger than ourselves. We've learned the importance of adaptability, resilience, and the power of community. We've witnessed acts of kindness, compassion, and innovation that have inspired hope and reminded us of the best of humanity. As we move forward from the COVID-19 pandemic, it's essential to do so with empathy and understanding. We've all been impacted by this crisis in different ways, and our experiences have shaped our perspectives, beliefs, and behaviors. It's okay to disagree, but let's do so respectfully. Let's listen to each other's stories, acknowledge each other's pain, and recognize that there's no one-size-fits-all approach to navigating this complex and evolving situation. The pandemic has highlighted the importance of kindness, compassion, and community. These qualities will be essential as we navigate the challenges ahead and work towards a more just and equitable future. Our shared humanity, a beacon of hope in uncertain times. The COVID-19 pandemic has been a time of unprecedented challenges, but it has also been a time of extraordinary human resilience, compassion, and innovation. As we move forward, let's carry with us the lessons we've learned and the connections we've forged. The pandemic has reminded us that we're all in this together, regardless of our differences. It has shown us that our shared humanity is a powerful force for good, capable of overcoming even the most daunting challenges. The road ahead may be uncertain, but we face it with a renewed sense of hope, knowing that we're not alone. We have each other, and that's a powerful thing. Seeking expert guidance, navigating the sea of information. Let's be real. Trying to stay informed about COVID-19 can feel like trying to drink from a fire hose. With conflicting headlines, ever-changing guidelines, and a constant stream of new information and misinformation, it's tough to know what to believe. That's where the experts come in. We're talking about the doctors, scientists, public health officials, and researchers who have dedicated their lives to understanding and combating infectious diseases. They're the ones sifting through the data, conducting the studies, and developing the strategies to keep us safe. Now, we know experts aren't always perfect, and science is a process of constant discovery and refinement. But listening to those who have dedicated their lives to these fields is crucial for making informed decisions about our health and the health of our communities. The evolving science, staying ahead of the curve with Dr. Anthony Fauci. You know him, you maybe love him, you've definitely seen his face on your TV screen for the past few years. Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, has become the nation's most recognizable and sometimes controversial voice on COVID-19. Dr. Fauci has been a steady presence throughout the pandemic, providing clear and concise explanations of the science behind the virus, the effectiveness of vaccines and treatments, and the rationale behind public health measures. He's also been a vocal advocate for following the science, even when it's inconvenient or unpopular. His willingness to speak truth to power, even when it means contradicting political leaders, has earned him both praise and criticism. Section 3. Public Health in Focus, a conversation with Dr. Rochelle Walensky. Another key figure in the fight against COVID-19 is Dr. Rochelle Walensky, the director of the Centers for Disease Control and Prevention, or CDC. The CDC plays a crucial role in tracking the spread of infectious diseases, developing public health guidelines, and communicating with the public about health risks. Dr. Walensky has led the CDC through a challenging period, navigating the constantly evolving science of COVID-19, the emergence of new variants, and the often contentious political landscape surrounding public health measures. She's emphasized the importance of clear and consistent communication, data transparency, and equity in the pandemic response. Dr. Walensky has also been a vocal advocate for mental health support, recognizing the toll the pandemic has taken on individuals and communities. Section 4. The Data Detectives, Epidemiologists on the Front Lines of Pandemic Response. While Dr. Fauci and Dr. Walensky have become household names, there's a whole army of epidemiologists working behind the scenes to track the spread of COVID-19, identify trends, and inform public health interventions. These data detectives are the ones analyzing case counts, testing rates, hospitalization data, and other metrics to understand the trajectory of the pandemic. They're also the ones investigating outbreaks, identifying risk factors, and developing strategies to prevent further spread. They're the unsung heroes of public health, working tirelessly to keep us one step ahead of the virus. Their work is essential for understanding how the virus is spreading, identifying who is most at risk, and evaluating the effectiveness of public health measures. Without them, we'd be flying blind in the fight against COVID-19. Section 5. Vaccines. Separating Fact from Fiction with Dr. Peter Hotez. Vaccines have been a game changer in the fight against COVID-19, but they've also been the subject of much misinformation and controversy. Dr. Peter Hotez, a leading vaccine scientist and advocate, has been a tireless voice of reason and evidence-based information in the often heated vaccine debate. Dr. Hotez has dedicated his career to developing vaccines for neglected tropical diseases, and he's been instrumental in debunking myths and countering misinformation about the safety and effectiveness of COVID-19 vaccines. He's emphasized the rigorous safety protocols involved in vaccine development, the overwhelming scientific consensus on the benefits of vaccination, and the importance of addressing vaccine hesitancy with empathy and accurate information. Section 6. Long COVID. Unraveling the Mysteries with Dr. Monica Verduzco-Gutierrez. As we've learned more about COVID-19, one of the most concerning developments has been the emergence of long COVID, a condition characterized by a wide range of lingering symptoms that can persist for months or even years after the initial infection. Dr. Monica Verduzco-Gutierrez, a physiatrist specializing in rehabilitation medicine, has been at the forefront of research and treatment for long COVID. Dr. Verduzco-Gutierrez has been instrumental in raising awareness of long COVID, advocating for increased research funding, and developing comprehensive treatment plans for patients struggling with this debilitating condition. She's emphasized the importance of a multidisciplinary approach to care, involving specialists from various fields, including pulmonology, cardiology, neurology, and psychology. Section 7. Mental Health Matters. Expert advice for coping with pandemic stress. The COVID-19 pandemic has taken a toll on our collective mental health. The constant uncertainty, fear, social isolation, and grief have left many feeling anxious, depressed, and emotionally drained. Mental health experts have been sounding the alarm about the need to prioritize our mental well-being and seek support when needed. Dr. Jane Doe, a licensed clinical psychologist, emphasizes the importance of self-care, stress reduction techniques, and seeking professional help when needed. It's okay to not be okay, says Dr. Doe. The pandemic has been incredibly challenging for everyone. Don't be afraid to reach out for help if you're struggling. There are resources available, and you don't have to go through this alone. Section 8. The Economic Outlook. Insights from economists on the road to recovery. The COVID-19 pandemic has had a profound impact on the global economy, leading to job losses, business closures, and widespread financial hardship. Economists have been analyzing the economic fallout and offering insights into the road to recovery. Dr. John Smith, an economist specializing in labor markets, acknowledges the challenges but remains cautiously optimistic about the future. The economy is showing signs of recovery, says Dr. Smith, but there's still a long way to go. The key will be to create jobs, support small businesses, and address the inequalities that were exacerbated by the pandemic. Economists emphasize the importance of government intervention, such as stimulus packages and infrastructure investments, to stimulate economic growth and create jobs.